And I think the fairness, I mean, I've heard this already, and I hear this from patients all the time, is I'm exhausted and I've been home all day and TV, you know, this. And so I challenge people. I'm like, okay, so can you journal? Can you video journal? Can you get out those photo albums that, you know, if you want a job, you can come to my house because I have photos, albums that need to be put together. You know, just those things that are, that I guess people will say it's legacy things, maybe in some way, shape, or form, but people don't like to think that way. They don't want to say, you know, I'm going to do this because, you know, I'm planning for this. I don't want my family to freak out because I'm kind of planning things. Well, no, it's filling yourself up. What's going to fill yourself up? I had a lady that she went home, you know, and she was adorable, and I loved her dearly, and she was fighting, and her poor little body was just done. And she's in the hospital. And I said, what are you doing? She goes, what do you mean, what am I doing? I said, why are you here? She goes, well, you asked me. That's what we are. So I just said, where do you want to be? And she goes, I want to be home. I want to be looking out I want to look out my window where I have the bird feeders. I go, let's go home. And he said, and when they bring you home, because they brought her home in the ambulance. This is the end of her journey, but part of her life. I mean, she talks about this as part of her life. And I said, when they bring you home, really irritate the ambulance guys. Make them sit in your driveway and let you just soak in the sun, which she did. She said, we sat there for 20 minutes. Michelle, I got my money's worth. It was really funny. So then I went to her house, and I have known this lady for a long time. I, you know, became very, very endearing friends with her and her husband. And I went to her house, and it was quiet. And this woman had this powerful laughter and was all about humor, and that was her journey. I mean, she used humor appropriately and inappropriately, probably through her journey. So we came in, and it's all quiet. And I'm thinking, why is it quiet in here? There's nothing about her that's quiet, you know? So I said, why isn't there something in the background? Why isn't there things that she likes? Whatever. So her husband pulls me into the kitchen and reads me this little journal article about this young woman, young girl, she's like 12, that she went to a Rotary Club to do her first speech. Well, her first speech was about farts. Believe it or not, that was her speech about all these, you know, blah, blah, blah. And her husband's reading this to me, and we're laughing in the kitchen. And I said, you need to get in here, and she needs to hear this. She laughed so hard that you should see the peace that came over her, that her breathing slowed down, her heart rate slowed down, just everything about her just slowed down. It was peaceful, and she sat and just giggled. Okay, that's the essence of kind of quality of life. What kind of drives you? What things bring you that inner peace and fill you back up? And that's what I challenge patients a lot of times. Is sometimes it's just stop. And if everybody in the room right now will take one big deep breath, take it in as deep as you can, and let it go. How do you feel after that? Pretty cool, huh? And sometimes it's just stopping and breathing. Stop and breathe. And that's that. Now, I'm not perfect. Today, my mind was bouncing all over the place, okay? My well-being was like this. You know, my son was in a bad accident at the end of September, and we were at the doctor while we were at lunch break. And he's okay, but I had my own things I had to balance back, you know, so that I can be back here, you know, and have him back where his place was. So we all experience this every day, and probably multiple times a day, where you're like, one lady goes, my ball is bouncing all over, Michelle. I'm like, okay, get a hold of it. You know, let's see where we can kind of get in the middle. You know, it might be simple, but I think it kind of gets to the core of where we're at, which is all of us.
Great analogy when your ball is bouncing all over.
Ball is bouncing all over.
Get a grip. Okay, questions from all of you for Michele.
His ball's bouncing.
Well, thank you again. My question is, coming from my daughter and coming from a friend of mine too, she has melanoma cancer, stage 4, and she was diagnosed in July. And now, you know, in the beginning, of course, she's 27 years old, and now, you know, in the beginning there was all this kind of support and oh my gosh, and I'm really concerned for you and that kind of feeling. And now, you know, it's January, and you know, people ask her, well, how are you? And you know, she's no better than she was 7 months ago. But they want her to respond with that, I'm okay now. Right. And, you know, I'm getting better, and that, you know, this interferon, it's all working and everything's okay. But none of it's better. Right. And my question is to help my daughter of how to respond, of what to say to people.
You don't always have to have a response. I guess that's what I try to teach my patients a lot, is that you don't always have to make somebody else feel better. You know, number one. Using I statements, you know, which one lady said, well, I'm Buddhist, and that feels like it's very selfish to use I statements. And I'm like, but it's easier to use I statements. You know, at this time, I'm not feeling, you know, 100% better to where I was. So it depends on the relationship, number one. You know, how strong is that? I tell patients, there's people that are going to have a core close to your ball, and there's people you're going to want out here. You know, that you're going to create some social distance because they deflate you. So in the person, is it your daughter that you're talking about? Okay. You know, so for herself, it's hard because patients don't want to tell their story over and over and over and over and over, especially when the outcome isn't feeling like it's gaining grounds. It feels like it's staying flat. Okay? So my people that are living with cancer, advanced cancers, that it's not progressing, but it's not regressing, it's just staying there, you know, like right here. And you think where everybody is in their analogy that, well, I'd be really happy if it was responding to something, and I'd be really happy if it would go away. And the people that really have a difficult time is when it's staying there, you know, because nobody knows how to continue to help in that situation, because general natures, we want to say, yay, you're beating it, everything's great. And the people that are staying flat struggle with, I'm still where I am, and I want to tell you something different, but every time you ask me, it just makes me feel deflated for staying flat. Does that make sense? Yeah. Does that make sense? Yeah. So in her own, that's where Caring Bridge, lots of helping hands, some of those internet resources where you can post things and create a social distance to some degree, because that story is being told in a different way, so that she can be protected from feeling defeated and feeling like she can't tell people the news she wants to tell them. She wants to say it's all better and it's going away, but she can't say that. She has to say, I'm here, I'm living with cancer, and there's good days and there's bad days, and today is probably a good day. You know, this is a good day, so here's what I need from you. I need you to come sit with me and let's do a project, or I have my window of time that I have the energy, so let's go to the mall for a little bit and know that we might have to grab a wheelchair because I might get tired. You know what I mean? Taking that piece of control back to say, here's what I need to fill myself, and I am okay with not having to make everybody else feel okay. Which you can see where people are like, oh, that's so selfish. No, no, no. That's your core. That's your balance. That's your, you know, I have wonderful friends, and I know the ones that I'm going to call for certain things. For if I'm down in a certain way, I know which ones I'm going to call. I know which ones are going to fill my cup back up, and I know the ones that are going to drain me. So in a certain situation in my life, I'm not going to call these certain people that are going to drain me. And for somebody who's really going to drain me, I try to figure out where my social distance can be. And not a dysfunctional way, because we have people that socially isolate, like completely isolate. Then we have, you know, more concerns there, saying they're totally withdrawing, and where are they, and can we get to where the distress is, that they're completely withdrawing. Yeah, and I'm not a psychologist. I play one on TV, but I tell people right away, you know, I'm not a psychologist. So if we need that help, that's where we need the help of, you know, social workers, psychologists, a psychiatrist, you know, those kind of things, because our mind is connected to our entire body. And there's not a day that we don't have that flux. We don't have that flux in our lives, even when we're healthy. Yeah, does that help? Yeah, she's here, and everybody wants her on one or other side of the domain. And she's got to figure out how to be here and worry about your core. Yeah, absolutely. They're going to, he's going to want you to use the microphone. What? You got to use the microphone. Oh, yeah. Be compliant.
I'm being compliant. I had mentioned earlier, just very briefly, this series I do called Renewing Life, and it's all about finding joy again, feeling like you're in control of yourself, and looking at all these circumstances of your life that have changed, and what are your values and priorities. And one of the sessions that we talk about is a lot of what Michele is talking about, is looking at your relationships, and we kind of break them down to 3 types of relationships, and when I say these words, you're all going to know exactly who they are in your life. And the first are the toxics, and everybody can figure out who their toxic people are. The second are the nurturing types of friends and family, and the third are the nourishers. And what we advise is to look at who your toxics are, and you know that these are the people that take your life energy, they just drain you. And what's interesting about anytime you come into a crisis and everything sort of gets unsettled and changes, is that the people you may have expected to be very nurturing or nourishing suddenly are toxic. And you can't quite figure it out because they've been in this one box, you know, blah, 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 and suddenly they're just draining you. But that's the flux of life. Things change. So what we advise is then you limit your time with someone that's draining you and not giving you life energy, but actually taking your life energy. Then the nurturers, we often talk about that, we say, well, those are kind of like the church basement ladies. I mean, they're the people that are bringing you food and getting you groceries and taking you to treatment and offering all this help. But they're kind of benign. I mean, they give you energy in the sense that they save you from task and all of that kind of stuff. And you need them in your life just to survive. But you don't, it's just kind of a flat line sort of a thing. And then there are the nourishers, and we have a handful. Some people just have one. But these are the people that, they're not the nurturers. They're not out there bringing you dinner and groceries, but they're bringing you inspiration and love and you know, authenticity. And when you get away from those, when you walk away from those people, you feel energized, you feel better. And so I think I'm just putting it into categories or whatever,
absolutely.
because this is what Michele is saying, is maximize your time with nourishers, that you don't have to sit and do a lot of explaining and blah, 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 but somehow, you know, that connection is just so genuine and good and healthy. And take on the nurturers, like I've been talking about, ask for help, take it, and try to avoid the toxics. And some of the toxics are these people that keep asking you over and over, wanting you to say, it's getting better, it's getting great, it's great, yeah, you know. You're going to have that at any level, but If people are just kind of coming at you with that expectation that you need to prove to them that you're better and you're healthy to make them feel better or something, all you can do is limit your time. There are no magic words.
Well, in a really great book, and they have it for kids and they have it for relationships, and really it was written by a psychologist for marriage counseling stuff, 5 Languages of Love. And the reason why I mention that is because if you understand what you need to feel loved, okay, and there's 5 languages to that, you can communicate better with your caregivers and the family around you, because a lot of the miscommunication is the fact that, well, he just doesn't understand. He doesn't make this for me when I need him to. Okay, well, for you, having somebody do something for you makes you feel loved, okay? But the person, what makes them think that they're loving you is maybe giving you gifts. Do you know what I mean, where the disconnect is? And I see that a lot, and, and cancer kind of brings it forward, that your expectation of what makes you feel complete and loved and communicated with, if you can't articulate it or share it with your partners, caregivers, loved ones, social network, then you aren't going to get reciprocated what you need. So I hear that disconnect a lot, that, here's what they're doing and saying, but that's not what I need. Okay, well, because if you read the book, it's really like, I mean, I even made my kids read it. The other thing is pull your cancer card out. Hello, you got a cancer card. Guess what? There's free stuff out there for you. Pull your freaking cancer card out every so often. There's massage, there's things that are out there that once in a great while, I say, I know you're 5 years out, but I say, I am a breast cancer survivor. Oh, hang. Oh, I mean, sometimes it's okay to pull your cancer card out. And with your cancer card, you're able to do things that you never would have done before. One of my longtime survivors jumped out of a plane. She said, never in my whole life would I ever think I'd jump out of a plane, but here I am. I faced cancer, so that was the best experience of my life. Extreme, okay, wouldn't advise it for everybody. But do you see what I mean? That it's that excuse that I've had cancer, and so I'm going to do a massage. I'm going to try acupuncture. I'm going to go to a camp where we have silence for 24 hours. I would be dead. I couldn't do that. But you see what I'm saying? Pull your cancer card out. I'm a survivor, and I'm going to eat junk food all day today, and tomorrow I'm going to eat better.